How much do prostate urodynamic studies cost? If you're wondering about the price of prostate urodynamic studies, you're not alone. These tests help assess how well the bladder and urethra store and releases urine, especially when dealing with prostate issues. The costs can vary quite a bit depending on where you go and what exactly is involved. On average, a urodynamic study can cost between $350 and $1,000. For those on Medicare, the typical cost is usually around $350 to $375. If you have private insurance, the charges tend to be higher, often ranging from $600 up to $1,000 or more. These costs include several parts of the test. For example, complex cystometrograms and pressure flow studies are common components that measure bladder pressure and flow rate. In 2014, Medicare allowed payments for these individual parts around $314 to $344. Uroflowmetry, which measures urine flow rate, usually costs about $16. Private insurance companies often reimburse at rates 2 to 3 times higher than Medicare, which explains the higher costs for privately insured patients. The price can also depend on the testing site and the procedures performed. A more detailed test, like a complex cystometrogram combined with pressure flow studies and urethral pressure profiles, will cost more than a simple uroflowmetry. Additionally, supplies such as urodynamic catheters have seen recent price increases, which can add to the overall expense. In the context of prostate health, these tests are sometimes used to evaluate urinary symptoms caused by prostate enlargement or treatment side effects. While they provide valuable information about bladder function, doctors will consider whether the benefits outweigh the costs, especially since these tests can be expensive and may not always change the treatment plan. To sum up, if you're a Medicare patient, expect to pay around $350 to $375 for a urodynamic study. For those with private insurance, costs can range from $600 to over $1,000. Remember, these prices include multiple test components and supplies, and recent increases in supply costs can influence the final price. It's always best to check with your healthcare provider and insurance company beforehand to understand your specific out-of-pocket expenses, as prices can differ based on location, provider, and coverage. Consulting your doctor will help you make an informed decision about whether this test is right for you and what costs to expect.